I'm Macarena. I'm a psychologist. I'm a co-founder of this day center for treatment of eating disorders.
And I'm Csaszar. I work here also as a psychologist in Centro Cava.
Can you provide any relevant facts or statistics about the impact and prevalence of eating disorders in Chile specifically?
There are no statistics in Chile, but
Most recent statistics are from 2011. The government hasn't really financed studies and haven't really visualized this illness here in this country. But as I said, the most recent statistics are from 2011, and it was about around 3% of the population, especially young teenagers, mostly female, do have an eating disorder. Doesn't matter if anorexia or bulimia, but any of those. And the other thing, which is very important, is that during the pandemic, we had a very long confinement here, and eating disorders increased in around 30% during this time. So it's been getting worse with the pass of the time, but yeah, we don't have any public help or visualization or whatsoever nowadays here in this country. It's all managed pretty much privately. And yes, we have a project. I think it's called a bill in English when you create a project. Okay, that's what we have nowadays, and nothing has happened till now. So everyone who wants to get treatment here has to do it financed by themselves, not with help from the government.
Yeah, I think that's with so many countries. Like I said just now with Belgium, no statistics, no any research from the government. And I think that's really sad to see in so many countries. I guess moving on to the next question, how did you guys become involved with eating disorder advocacy in Chile, and what motivated you to do this?
it's like fate. I don't know. I started working in eating disorders in France. I lived in France. I lived 12 years there. And when I was making a master, I started working with this subject, and then I just keep doing that. And then I come back to Chile, and I said that, like, there are no much people working in and specialized in that field in Chile, so that will be a great thing to do. And I just keep doing this like for 20 years. I don't know.
In my case, well, I also had an eating disorder as it was your case, and I was actually a patient from another psychologist that works here. That's also a co-founder here. And well, after recovery, time passed. She contacted me again to see how things were going in my place. After my eating disorder, I studied psychology. I wanted to specialize in this subject, and then I started working here in Cala, and since then I've been here. I think something that's very important here, especially in this treatment center, is that a very important topic is the visualization of this subject, because it's very normalized in society, being in some way, looking some way like the stereotypical person. That's something that happens a lot here, especially in the upper class. And yes, in my case, since I saw this from inside, and afterwards, after studying all this and starting working here, seeing that this is actually a problem that like generates and worsen this illness, I continue to work here. And well, that's what we've been trying to do, like the visualization and trying to show that this is not normal. Trying to fit a stereotype is not normal in comparison with other places, which aren't many here in Chile. It's a very important topic, this like social visualization about what it is to have an eating disorder, and that's actually not normal.
I think that's so special. I like how both of you have a lot of like psychological background in this, so that elevates what you're doing so much more. And yeah, I definitely think there is a social component, and people really need to know that eating disorders are not normal, because I think that's something that's also in Asian cultures. We think that not eating or being really, really thin is good. And I don't think that should be true. But tying into that, it's another question, but do you think there are any cultural or societal things about eating disorders that are very specific to Chile or Latin American cultures that is different to the rest of the world?
I don't think so. Not really. I lived in France and I have the different cultures view, and I don't think there are cultural difference. Even more now because like Anne said before, it used to be an upper class illness, but we can see now that it's not anymore like that. More and more men suffering of eating disorders, and I'm a little scared now of what we are doing as a society, because I think everything that we do is a bad factor to develop an eating disorders, because internet and social media and everyone is talking about what they are eating, the healthy meal, what it's like to eating healthy, and what it's like to doing sport like 4 hours a day, and young people reach that kind of message 5 hours a day. So I don't know. I understand why we are seeing every day more and more young people with this illness. It's very sad, and I think it's worldwide. I don't think it's only here in Chile.
Mhm.
Yeah, I think I completely agree. I think it's an issue we really have to tackle in the whole world. As you said just now, you think that a lot of people in society think it's normal to, have, I guess, maybe disordered eating patterns. Have you seen other types of misconceptions or stigma surrounding eating disorders in your community?
Stigma could be like it's a women illness. That's a stigma. That's not anymore true. It was like 20 when I started working with eating disorders. It was like a very different rate between men and women. It was like 10 men and 90 women. It was like that in the literature, in the clinical work, and that's not anymore like that. But it's still a stigma. So now men doesn't ask for help because it's a women illness.
Also, what Maca said before, nowadays it's not only an upper class illness, but a social illness. Weight isn't an only index about if a person is ill or not. Normally people think that you have to be really, really thin, thin to have anorexia, for example. Nowadays, it's not like that. People with normal weight can also have an eating disorder and or being overweight as well. It's not a central factor like it was understood before. Exactly.
And we used to hear that with patients that said that, oh, but I'm not that thin, so I am okay.
And family do think that as well.
Yeah. And they say that to them, so it's awful.
And often it also happens from doctors and medical stuff. They say like, oh, okay, but you aren't thin, so it's not bad. It's not important.
It's not that bad.
So yeah, how do you guys kind of tackle these stigmas? As you said just now, like families, they might say that to patients. Do you kind of inform the families about it, or do you try not to take any action in that way?
Yeah, we do it. We do it with, especially with families. We do a lot of psychoeducation, we call it. It's like inform what is good to do with the patient and what is not good to do. Is not talking about bodies, for example. That's very common here in Chile. I don't know if it's everywhere like that, but it's like, oh, you are thinner, you look so nice. That kind of comments, and we explain to families that is not a good way to talk about bodies, or not talking about food, what is healthy food or what is not a healthy food, because there are topics of scare our patients. It's like we are trying to make them eat like everything, like chocolate, like cookies. We banish talking about healthy food and not healthy food, but the environment is not like that here. After pandemia, I think it's like a boom with all this what is healthy meal. There's a lot of gordophobia also, a lot of fat phobia, because COVID was associated with obesity, So I think that made a very, very bad mixture of things that started to scaring people of being overweight or being obese.
Work as a daycare center. So patients come here in the morning, are here around, during the whole day. They get their 5 meals a day, and they return to their homes at night. During the week, it's only from Monday to Friday. So in this time, patients also get a group therapy and individual therapy, and there are these moments where this information gets also trespassed. They are educated. Patients here, especially those who are already coming for some time, months mostly, they already know what you can talk about, what's not good to talk about, the body, like bodies of others and the bodies of themselves, food, calories, and those stuff. And this is mostly, especially to educate families. There are group family therapies or family like psycho-education. And yeah, we try to stay in contact constantly with them to make sure that they are following also what we do here at home with the patient, so that they don't get some information here and another information that could be counterproductive for them at home. And yes, so the strong point here is that we mostly work during the day with the patients, but families are also always involved.
I think that's so good. I think most daycare centers around the world don't touch the families at all. And I think what you're doing with psychoeducation is really, really good, because families are big factors in developing eating disorders, I think. What do you think youth or just people in Chile can do to help reduce kind of eating disorders? And how do you think that more people can access the psychoeducation that you guys are providing?
There is a movement here. It calls Don't Speak of Others' Bodies. I think we have to create movements that shows people that any comment about bodies or any comment about food, what are you eating, that kind of stuff, it's a risk factor to develop eating disorders. And the other thing that is, I think, important is to stop diets. But I don't know how to do that, because if you go to the doctor, the first thing to do, if you are overweight or obese, is like, okay, you have to do diet. And we know that it's the main factor to develop an eating disorders.
I think education plays a really important role here, even like through the government and also in universities, education to people who is studying in some health studies and so on. And also it's very important that people bring up their voices, and most, at least here in Chile, a lot of change has been made by people standing up for themselves. And then if this keeps going, people are eventually listening. So as I said, we have a bill for EDs nowadays, but nothing has happened because EDs are still understood as a chronic condition that can't be recovered from. And yeah, there is a lack of information that's very important, so that we can move forward, and that the government, the state understand that this isn't a lost cause, and if they give resources to research and to places where this illness is treated, then there can be a recovery. And well, for that we need to spread a little bit more the word. That's what we are doing. We are trying to do in our small community, but the idea is that this happens more and more, and not only in Chile but worldwide, so that this information gets around the world and change is made.
I completely agree. Spreading the word, spreading awareness is probably one of the most important things to do. It'll eventually reach the government and they can create real change in the world. And I think that's so important.